So once the sensory needs of the child have been addressed, in terms of biology, certainly dietary solutions and pharmacotherapy issues are going to arise as you teach students with autism spectrum disorder. Many parents believe that the interfering behaviors seen with this child with autism comes from gastrointestinal issues or from the gut. There are vitamins and minerals that are given to children that are supposed to help the gut function properly. And you will probably also come across students that have a restricted diet of gluten, casein free. Gluten, casein essentially would include any food with wheat or dairy. And parents believe that that also decreases the interfering behaviors or aggressive behaviors. But there really is no sure evidence to show that the gluten-free diets really are more than a placebo. However, I believe if a parent feels like it helps the student, then we need to support the parent in whatever their wishes, dietary needs are for the child. So I'm sure the parent will give you the restrictions for the diet. In terms of pharmacotherapy, there are no medications that can cure autism spectrum disorders or even treat the main symptoms, but there are medications that can help some people with related symptoms. For example, medication might help manage high energy levels, inability to focus, depression, or seizures. Also, the U.S. Food and Drug Administration approved the use of risperidone and aripiprazole to treat children with autism at certain ages that have severe tantrums, aggression, and or cause self-injury. The textbook has a nice list of the drugs with the names and the drug type so that you can be more aware of the certain drugs that the student are taking and why. The use of psychotropic medications or drugs that affect the mind, behaviors, and emotions is one of the most common forms of treatment for individuals with autism spectrum disorder. Primarily, medications may decrease the serotonin or increase the dopamine. Doctors are trained to weigh the benefit to risk ratio for medications. It's important for you to educate yourself on the potential side effects of medications if you have a student taking them. As you have read and understand, one unfortunate characteristic of autism spectrum disorder can be increased risk for depression and suicide. So antidepressants are having a more supportive research because it's believed that serotonin plays a role in the development of autism. And antidepressant medications impact serotonin. That can be helpful for the students with autism spectrum disorder by improving social relationships and decreasing aggression, tantrums, depression, anxiety, etc. I've already briefly mentioned the antipsychotics, but the research supports with early studies of using antipsychotics that risperidone works to reduce serotonin and dopamine, thus decreasing aggression, impulsivity, and hyperactivity for individuals with ASD. And they also showed improved communication. And then, of course, stimulants are the common medication for ADHD, have also been found to decrease impulsivity, hyperactivity, repetitive movements, and oppositional behaviors and tantrums for individuals with autism spectrum disorder. They are seen to benefit from the stimulants similar to others. So when you're incorporating pharmacotherapy, because a parent chooses to have their child follow a doctor's order and prescription, you will have to be aware of potential side effects and help the parent monitor those and determine whether there are benefits outweighing the cost to these medications, because pharmacological treatment is not appropriate for every individual. And if a parent is not using a pharmacological treatment, it could be that they've tried it in the past and it didn't work. So, to sum up biological interventions, we're looking at sensory, diets, and medication. But we have to realize that we have to look beyond the immediate antecedents and discover ways to support student needs. All biological needs should be considered in planning. So we also have to consider the general health, hunger, pain, fatigue, illness, and nutrition of our students. We don't have a lot of information on interventions for this population, but through functional behavior assessment, we can identify patterns, and it's important that we do consider the biological factors beyond immediate antecedents. Okay, I hope that you guys are, I'm going to turn my camera on and say hi. I look forward to seeing you again soon.